Hi there. In this video, I'm taking a detour from the normal sort of themes to focus on neuropsychiatry. So this video is on the neuropsychiatry of fearlessness, um, focusing on the amygdala. Um, Thinking about human behavior, the human brain and body are designed for survival. Survival mechanisms are necessary, but not sufficient for a good life, obviously. But we're focusing just on the survival aspect in this video. So there are unpleasant physical and emotional states, such as pain and fear, that have a very important role in our survival. So, for example, there's a condition called congenital insensitivity to pain, which is resulting from mutations in the genes needed for nociception, which is pain reception. And failing that mechanism, the higher centers cannot be informed of noxious stimuli in the environment. And patients usually with CIP, develop a lot of infections, occult wounds. They have poor wound healing because they keep re-injuring, and all kinds of issues. And their morbidity is much higher than the relative population that don't have CIP. Now, I'm not going to be talking about pain in this video, but about fear. So there is a condition called Urbach-Wiethe disease. It's very rare. It's only seen in 400 patients throughout the entire world. It's very rare. A prize to anybody who can name another condition, it's genetic, that only has 400 patients around the world. I'll be very impressed if you know that. So in this disease, patients have a normal lifespan relatively, but they do have a bit of social handicap because of fearlessness, and this is because of a problem with their amygdala in the limbic brain. Now let me explain the pathology. So the pathology is that they have a loss of function mutation in chromosome 1q21, whose locus contains a protein called extracellular matrix protein 1. So as a result, you get as the name suggests, you get extracellular changes. You get soft tissue thickenings, hyaline deposition, calcifications, and these are specific to the skin, with the skin lesions, oral mucosa, vocal cords leading to hoarseness, and also the microvasculature, most notably the brain. Now, in this condition, the amygdala can be affected because of calcifications of the small vessels that supply the amygdala, which is located in the medial temporal lobe, and this can lead to either neurological deficits such as a focal temporal lobe seizure, or to a neuropsychiatric picture, which I'm focusing on, which is the loss of your fear conditioning system. So in what way are these patients fearless? Retrospective analyses of patients with this condition showed higher rates of being victims of financial fraud, being in car accidents, and also engaging in other high-risk behaviors, and being unable to learn, being able to change their behavior, being guided by fear, fear memories. So they can't form fear memories because of that amygdala dysfunction. Now, if I can give an analogy actually to anterograde amnesia. So in anterograde amnesia, of different of other types of memory, you have a stimulus, but you're unable to store it in long-term memory. For example, you forget where your keys are, or you forget what the name of that gentleman is. That's anterograde amnesia with respect to semantic or to episodic memory. Now, in this condition, you have a form of anterograde amnesia, but not for these memories, but for fear-conditioned memories, interestingly. Now, in stark contrast, there are some forms of temporal lobe amnesia where the patients, they cannot remember, the name of the person or what their job is, but they can tell you if they have caused induced fear in you. So, let's say that if you have this form of temporal lobe amnesia, and someone comes to you, his name is John, and he hits you in the foot. He steps on your foot and it causes pain, and then your amygdala is active in these patients, and it causes fear. Now, the next time that patient meets that particular person, they won't know, oh, this is John, or what his job is, but they'll have some kind of physical aversion, or they will feel fear in the body because the amygdala is still functioning. Coming back to the original condition, in Urbach-Wiethe syndrome, patients do not experience fear conditioning. Now, I'm not. This is not. This is not a medical advice. This is not set in stone fact. I'm not saying that you should use my video to start to tell to diagnose people. Please don't do that. This is just for guidance and just for your personal interest. And in 2013, Feinstein et al. In King's College London did a study into patients with bilateral amygdala dysfunction. Now, they hypothesized that by giving a physiological stress, which is excess CO2 inhalation, that the patient would develop this, they would not develop a fear conditioning mechanism, but they would just develop physical symptoms of metabolic acidosis without the psychiatric symptoms. But what actually happened is that when patients with bilateral amygdala dysfunction breathed in the carbon dioxide again and again and again, they all developed panic attack, which is a psychological, psychiatric symptom. So the conclusion to take from that paper was actually that the amygdala is important, plays an important role in fear, but in truth, it is necessary but not sufficient. It plays one role, but it's not all that's needed for fear conditioning. That when you're faced with an internal stressor such as acidosis or hypoxia, your fear, you will have deeper layers of fear coming up and presenting itself in the form of panic. So in summary, from this video, we talked about the neuropsychiatry of fearlessness, focusing on the function of the amygdala, talking also about the psychological or neuropsychological concepts of amnesia with respect to episodic and semantic memory, but also in respect to this novel idea of fear conditioning memory, and how in patients with bilateral amygdala damage, as shown by Feinstein et al. In 2013, that the amygdala is responsive to environmental threats, such as social cues, that tell you that there's harm in the environment, but the amygdala is not enough to process internal physiologic threats such as acidosis and hypoxia. So I hope you enjoyed listening to this video. I certainly enjoyed making it. See you later.